Good afternoon, everyone. My name is Cynda Crawford. I'm one of the shelter medicine faculty at Maddie's shelter medicine program in Gainesville, Florida. My topic for presentation this afternoon originally was management of distemper outbreaks in shelters, and I added on parvo to that because the intervention strategies that I would like to introduce actually are very similar for both distemper and parvoviral outbreaks in Florida shelters, as well as shelters in the United States and globally. I don't have to tell y'all that distemper and parvovirus are one of the most highly contagious viral infections of dogs if they have no pre-existing immunity to either virus. These are the two most common, potentially deadly diseases in dogs in Florida shelters, as well as other shelters in the country. It certainly is a frequent cause of euthanasia, and many shelters in the state have been impacted by outbreaks of either virus and sometimes simultaneous outbreaks. And as I look out into the audience, I can see a few people that we have worked very closely with in trying to manage their shelter out of distemper outbreaks in particular. You're also very familiar about all the negative impacts that disease outbreaks can cause in dogs in shelters. Certainly, one of the more important ones is euthanasia of adoptable dogs. The bottom line is that these outbreaks result in decreased life-saving capacity for the shelter. And there's certainly perceptions of the community about the shelter during these disease outbreaks. It leads to low staff morale. They're very costly. All of the scarce budget gets reallocated towards managing the disease outbreak, leaving very little left over for normal shelter operations. So I want to emphasize a little something about canine distemper virus so that we can understand why it is so common in the state of Florida, particularly South Florida. It's because this virus is so widespread in the wildlife reservoirs, in particular raccoons, foxes, and coyotes, which we have millions of in the state. And they have a very high endemic rate of infection with distemper. These infected reservoir species can spread the virus to susceptible dogs that don't have immunity induced by vaccination or prior exposure. And certainly for the open admission shelters tasked with animal control ordinances, you're very well aware that free-roaming dogs can interface with infected wildlife species and become infected, and then what's the most common type of dog brought into an open admission shelter is a free-roaming dog. Likely has never had any veterinary care in the past, including any vaccinations. The raccoons are very heavily populated around feeding stations, including those set out for feral cats and TNR management programs. Every shelter has a dumpster. Usually the dumpster is teeming with a gourmet for these raccoons in particular. And then most open admission shelters tasked with enforcement of animal control ordinances also have to pick up wildlife when somebody calls to complain about raccoons in their yard, foxes in their yard, and so forth. And so they pick up these raccoons and foxes and put them in their animal control vehicles in the same compartments that dogs are put in. So if a raccoon is shedding distemper virus in that compartment, and the compartment is not sanitized before another animal is put in there. If it's a dog that has no immunity to distemper, then that's one route of infection. So we've had a lot of distemper in Florida, and I've been tracking laboratory-confirmed outbreaks since 2006. There have been outbreaks in 16 shelters, most of which are municipal open admission shelters scattered throughout 13 counties, mainly in the peninsula of Florida. And 3 of these shelters have had recurrent outbreaks of distemper. Once they managed their way out of one, it wasn't too many months later before it recurred again. Dogs of all ages are susceptible to infection by both distemper virus and parvovirus if they have no immunity, either from vaccination or recovery from prior infection. The age group that's most vulnerable are puppies, and this is because they have waning passive immunity from maternal antibodies, and the maternal antibodies no longer provide protection against infection, but they still are present enough in circulation to interfere with any vaccination or immunization attempts of these puppies. So they are left in a window of vulnerability where they have no protection against either distemper or parvo, despite numerous efforts to vaccinate. They will not be successfully immunized until that maternal immunity has waned below the threshold of interference with vaccination. So they have the highest mortality when they are exposed to either virus. But unvaccinated adults also can become infected. They typically can have a much milder disease from infection with either virus, and they have a higher potential for full recovery. In addition, they are the group most likely to have a subclinical infection. They are infectious to other dogs, but they themselves are not ill, so we do not even know they're infected. And in the shelter environment, debilitation certainly contributes to the severity of disease that animals will experience. For instance, if young puppies are co-infected with coccidia, have skin disease, they're malnourished, they're stressed, all of this can potentially increase the form of illness that they will experience. In this state, we typically think of distemper as an acute respiratory infection. For some reason, most of the distemper biotypes in Florida tend to focus on the respiratory tract, resulting in kennel cough-like syndrome. There is usually a copious nasal discharge, especially in the first or second end of the first week of infection. You can have ocular discharge. There's some coughing, especially when there's pneumonia. And nearly all young puppies infected with distemper will have some form of pneumonia, whether it's clinical or subclinical. If you take a thoracic X-ray, you will see evidence of pneumonia. But it's a systemic infection, so it also infects the gastrointestinal tract. And we've run across a couple of biotypes of distemper virus that actually didn't cause much in the way of respiratory disease, at least that was recognizable. Instead, these dogs would vomit and had waxing and waning diarrhea, sometimes with blood or without. It looked a lot like parvovirus. And when you test them using a parvoviral antigen ELISA test, such as the SNAP test, they continuously and persistently test negative for parvo. And so we tend to ascribe their diarrhea to maybe dietary change, parasitism, and so forth. And when I look back, I wonder how many of those dogs with parvo-like disease that always tested negative for parvo actually had distemper. I imagine a lot of them did, especially based on our experience in Bushnell, Florida, that I'm going to wind my presentation up with. It also infects the urinary tract, the neurological system, and the skin. And we're also seeing a lot more skin presentation with some of the canine distemper biotypes in the state. We are seeing puppies now with the waxing waning diarrhea and lots of pustules on the skin, as shown in this middle photograph. In addition, the infection in the skin causes your typical hyperkeratosis reaction in the planum of the nose, as shown in the picture on the right. And then you get the hard pad, hyperkeratosis of the foot pad, resulting in the old name for distemper, which is hard pad disease. When the virus infects the neurological system, you can have a very hypersensitive dog, a dog that is very painful on touch of anywhere on the body. They are squinty-eyed because they're probably having some photophobia too from viral infection of the optic nerve. And then, your typical seizure-like activity that this virus can induce with chewing gum seizures is one way of describing the myoclonic seizures that can be seen in some dogs infected with distemper, certainly not all. But what about parvo? Nothing new here. It is truly an acute intestinal infection with some bystander effect on the bone marrow. Most dogs die of dehydration or sepsis, but certainly it is probably, parvovirus should be on high index of suspicion for cause of sudden death in young puppies with no prodromal syndrome at all. What are the risk factors for outbreaks of distemper and parvo in the shelter environment? Certainly, having a population of dogs that don't have protective immunity, which is most shelters. Crowding of dogs together. Random commingling. Crowding usually results from the random commingling of dogs and runs. So you're taking unrelated dogs and putting them all together in one run. When one leaves, then you put a new dog in, so there's another additional contact event going on. Lack of segregation based on age, so puppies being housed with adult dogs. Remember, puppies are the most vulnerable to these two viruses, and adult dogs can be subclinically infected. So they're harboring and shedding the virus, which could easily infect puppies that are housed with them. For every day that a dog stays in the shelter, their risk for acquiring a disease in the shelter increases significantly. So certainly increased lengths of stay in a shelter increases the probability of having shelter-acquired disease. Improper vaccination strategies and sanitation protocols, using the wrong disinfectant at the wrong time, and probably very important and very common is the lack of recognition of ill animals, followed by lack of prompt removal from the general population. So typically, especially dogs with any sort of acute respiratory infection are left in the general population thinking they have Bordetella, when in reality, in this state, they could likely have distemper. So I want to talk a little bit about susceptibility of dogs in Florida, entering Florida shelters to infection by distemper and parvo. And we did a study with our shelter in Alachua County that this was right after a big distemper outbreak that resulted in the death of 600 dogs. And that prompted our curiosity about how many dogs are coming into our shelter that don't have immunity to parvo or distemper. I mean, I would have thought most dogs did, especially since the common age entering a shelter is 1 to 2 years. Surely they're immune to either virus by then. So we collected serum samples from more than 400 dogs and tested for antibodies to parvovirus and distemper virus, and particularly measured if the levels were above the protective threshold or not. So what this graph shows is the percent of those 431 dogs tested that did not have protective antibody to either distemper or parvovirus on admission into our county shelter. More than half of the dogs coming in were susceptible to distemper virus infection. So if half of your shelter population is susceptible, and one dog that has encountered a distemper shedding raccoon while running around the neighborhood is brought in and has become infected and is now shedding, half the dogs in the shelter are susceptible. So that would start an outbreak very quickly. And a third of the dogs had no immunity to parvovirus. So that was quite an eye-opener for us in terms of vulnerability of dogs to these two common viruses when coming into the shelter. 10% had protective antibody titers to distemper and not parvo. About a third had protective antibodies to parvo but were vulnerable to distemper. And a full 1 out of 4 dogs entering our shelter did not have antibody to either virus. It sort of drives home our recommendations for vaccination immediately on intake, using the modified live distemper parvo vaccine and repeating it at 2-week intervals, depending on the age of the dog. And speaking of age, we also looked at age susceptibility to distemper virus and parvovirus infection, and in this case, it's to distemper. So this is 3 age groups, common age groups of dogs in Florida shelters. And those less than 1 year, 83% of them were naive for distemper virus. The common age group, more than half were susceptible to infection. And then the older dogs, it was still 1 in 4. And then if you look at parvo, it still follows the same age predisposition based on lack of protective antibody titers. And I was sort of astounded right here that 20% of the dogs that are over 1 year of age did not yet have protective immunity to parvo. So this is kind of driving home why we so frequently have outbreaks of distemper and parvo in our shelters. And so what is the response? What can we do when we're faced with these either virus causing infection of multiple dogs in our shelter? Certainly, to create a clean break, we can just euthanize all the ill and exposed dogs and then start over, repopulating the shelter. And this, in hindsight, I think this actually may be the most effective approach to stopping an outbreak if you're dealing with a small number of dogs. It might just be the easiest, most cost-effective way to stop the spread of either virus in the shelter and involvement of more and more dogs, particularly if there are new admissions coming in every day. But are there other viable options, particularly for shelters that have large numbers of dogs on site every day? I don't think anybody would relish the thought of euthanizing 250 to 400 dogs that have been exposed to distemper virus or parvovirus. So we've been very interested, along with other shelter medicine programs in this country, on what are other effective ways of managing these outbreaks without resorting to mass euthanasia. In the new shelter medicine book, Dr. Hurley has a great chapter on disease outbreak management, and these are some of her tools. for life-saving alternative strategies to mass euthanasia. Certainly, diagnosis is the first step, because if you don't know what you're dealing with, there's no way you're going to know how to control it, much less kill it. Isolation of sick dogs is an important step. Quarantine of exposed dogs. Decontaminating the environment to reduce the infectious load. And then what are you going to do if you're a shelter that has to admit new dogs every day of the week? That you cannot stop either admission or adoption like some of the private shelters can do. So you have to do something about preventing the spread of infection to newly admitted dogs. So let's start a little bit with diagnosis. It absolutely is essential to successful control of outbreaks. When you know what you're dealing with, you know how long the incubation period is and how long the dog is contagious based on the shedding period. You know how the pathogen is transmitted, and you know what type of disinfectant is required to kill it. So if you don't know if it's distemper or parvo or bordetella or any other infectious disease, you cannot proceed with managing the outbreak using the tools. The incubation period determines the length of quarantine. So that's an important principle. How long do you quarantine an exposed population of dogs? It depends on what they're exposed to, but it's the incubation period for the pathogen that they've been exposed to. The shedding period determines the length of isolation. How long do I keep dogs, ill dogs, isolated from other dogs? Well, it's the amount of time that it takes to resolve shedding of the pathogen. Diagnosis is also essential for proper patient management. What are the treatments? How much does it cost? What's the prognosis for survival? And what's the average time to recovery? So here is a table I put together on the basic properties of both distemper and parvovirus. The incubation period. Do they shed during the clinically silent incubation period? Are there subclinically infected dogs for either infection? How long do the clinical and subclinical dogs shed virus? Because that determines your isolation period. And how is it transmitted to other dogs? Certainly, distemper has many, many more opportunities for spread between dogs because it's shed in virtually all secretion and surfaces of the body. Respiratory secretions, sneezing, coughing, all the discharges, aerosols generated by coughing. Dr. Appel at Cornell determined that distemper virus can travel at least 20 feet in aerosol form. What's the average width, distance between in a ward where there's two kennels facing each other? 6 feet? 8 feet? So you have dogs coughing on one side, and they have distemper. It's easily going to make the leap across the aisleway to the other side of kennels. Some people forget that the animal's fur will be coated with virus, both with distemper and parvo. And certainly one of the most important routes of transmission for either virus in a shelter situation is the staff that handle shedding dogs, contaminate themselves, and then go down the road and handle other dogs. So they are just the perfect shuttle for either virus to spread it within minutes from one end of the kennel to the other end. Certainly not all cases of respiratory disease or gastrointestinal disease are due to either distemper or parvovirus. Therefore, we can't diagnose based on clinical signs, and that is certainly a very common tendency. Not all dogs infected with either virus are sick. They may not be sick because they're in their preclinical incubation period, and we know that dogs can have subclinical infection with either virus. But timely diagnosis impacts how many dogs remain healthy and adoptable. The longer it takes to diagnose and then manage based on the correct diagnosis, the more dogs are exposed and infected, and the transmission just goes on, so that it might require mass euthanasia to resolve the situation. The same for no or late diagnosis. Guessing will certainly guarantee an outbreak. We recommend diagnosing canine distemper virus using PCR, because this is a very sensitive and specific technology that can pick up the most minute amounts of virus. And since this virus is present on mucosal surfaces in nearly all orifices of the body, you can swab and these surfaces and scrape off some of the epithelial cells and submit the swabs for PCR analysis for distemper virus nucleic acid. So we like to take swabs of the conjunctival sac, as shown in the upper panel there. It's very painless for the dog. They'll let you do that all day long. And you can get good amounts of virus if that dog is infected with distemper. We also like to try to do a nasal swab. Dogs will give you one try for that, and that's it. Unless they're a greyhound, and a greyhound will stand there all day while you put the swab all the way up to the cribriform plate. So you get one try at the nose, and you don't just want to do the upper lip. You want to really get the tip of the swab into the nostril as far as possible and do a quick rub, and out you go. And for dogs that won't allow you to do a nasal swab, then certainly open up the mouth, if they'll let you do that, and put that swab all the way over the back of the tongue towards the tonsillar area and scrape a little of the epithelium off, and you've got a good sample that way too. And then we pool the swabs from all of these sampled sites into one tube. It's counted as one sample for that dog, because this maximizes our opportunity of finding distemper virus if it's there. We like to select dogs with clinical signs and those that are exposed to these dogs but are not ill themselves. We have been submitting swabs to IDEXX for a few years now, ever since they offered their canine respiratory pathogen PCR panel. We've been very happy with it. I know Antec now offers the same type of canine respiratory pathogen PCR panel. It's probably very good. I just don't have as much experience with their version yet. The one thing about PCR is it cannot differentiate a pathogenic street strain of distemper from a modified live non-pathogenic vaccine strain of distemper. So because it cannot differentiate between the two types of distemper, you can have vaccine interference in a very small number of dogs who were recently vaccinated with a modified live distemper virus combination vaccine within 2 weeks. But it's a very small percent. And then, of course, I think all of us use some type of rapid point-of-care kit. It's basically an ELISA-type format to test feces for parvoviral antigen. These kits, or at least the IDEXX kit, has been shown to detect all the subtypes of canine parvovirus. You hear a lot of talk about the new subtype 2C parvovirus, and it has been shown that these kits will pick up 2A, 2B, 2C, all the known strains or subtypes of parvovirus infecting dogs worldwide right now. Unfortunately, unlike PCR, which has sensitivities in the mid-90s, these screening ELISAs for parvoviral antigen have lower sensitivities, about 75% at best. And the reason for the lower sensitivity of this type of test for parvovirus is because infected dogs intermittently shed virus. So they can test negative one day, test positive the next, test negative the following day because of the intermittent shedding pattern. And there are dogs, possibly those that are subclinically infected, that shed very low amounts of virus in their feces. So the threshold for these kits cannot pick up those low amounts of virus, so they'll test false negative. This is necropsy, I think, is one of the most valuable diagnostic tools in the shelter environment. Possibly more valuable than necropsy on owned pet dogs. Frequently, people know why their pets die. Most of the time, we don't know why our dogs in our shelters die unless it's via a euthanasia solution. So necropsy is very seldom, it's an opportunity that's very seldom explored. Certainly, it would be very appropriate to necropsy any dog with an unexplained or sudden death. Could be parvo. It's very useful for confirmation of results from other types of ante-mortem testing. And if you have a high clinical index of suspicion that a dog has distemper or parvo but repeatedly tests negative, and it's ill enough to warrant euthanasia, then a necropsy would be very valuable for determining the true infection status of that dog. I like to collect, if I'm suspicious of distemper, and my nasal, conjunctival, pharyngeal swabs were negative by PCR, but I still think that dog may have had distemper. Maybe it was subclinical, not shedding enough virus. I like to collect the lung and urinary bladder and submit those tissues to IDEXX for PCR, because they will accept tissues for that analysis. I don't think Antec does yet. The distemper virus concentrates in the urinary bladder. So if you're going to pick a tissue, pick the bladder. And then, of course, for cases suspicious for parvovirus that were negative on the SNAP test, you can do an ELISA. You can do the SNAP test directly on intestinal contents during necropsy. You can also submit intestine for parvoviral PCR to some laboratories. Again, IDEXX would perform that for you. And then a little-known fact that it's not widely known is that, like the bladder is like the focus of concentration for distemper replication, the tongue can be the focus of replication for parvovirus. So that would be a useful tissue to not only have histopathology results on, but possibly also submit to a laboratory for PCR and even virus culture. So now we're going to get to the intervention strategies. What are the life-saving alternatives that have a good potential for maximizing life-saving capacity during a distemper or parvovirus outbreak? Well, the number one principle of these strategies that I'm going to propose are to create a clean break between the infected and exposed dogs and any new admissions if you're a shelter that cannot shut down intake during an outbreak. This requires the tools of isolation of sick dogs, certainly to prevent further transmission of the viruses to other susceptible dogs. It also reduces the infectious dose of that virus in the environment. It also involves the tool of quarantine. What do you do with the exposed dogs? Do you just kind of automatically think, well, they're not sick, so they're probably not infected, I'll send them on to adoption? No, they have to be quarantined because they've been exposed, and if they have no protective immunity, there's a good probability they're going to get infected, and they're just not sick yet because they're in the incubation period. So they need to be quarantined away from other dogs. And then new admissions also need to be housed separately from either the isolated population or the quarantined population. I think isolation of sick dogs from the general population is probably the single most important step to reducing transmission of virus in the shelter. Need to have good physical containment facility for this to contain the pathogen within the four walls. A couple of questions to ask about the capacity to have an adequate isolation and biosecurity situation is whether this situation is physically contained and how are the staff moving back and forth. Are there biosecurity protocols that are being adhered to? If it's risky, then consider some other site for sending sick dogs to for isolation and potential recovery from infection. Can the shelter treat either distemper or parvovirus on site? Most shelters can't because of costs and how long the animals have to be held until they're no longer shedding either virus. So both diseases are treatable, particularly in older dogs, with the potential for full recovery and a nice life as someone's pet. But if it can't be done in the facility, then consider transfer of these sick and contagious dogs to another group that's well set up to handle both isolation and treatment. If there is no such option, then euthanasia of these ill animals is probably the most humane option at that point. So remember, we isolate for the length of the contagious period. For distemper virus, the virus is shed for weeks to months on average. I tracked a dog in a Miami shelter that shed the virus, detectable by PCR, for 6 months. And it was held in isolation for 6 months. So it spent its entire puppyhood in isolation. For parvovirus, 2 weeks is considered the contagious period. The staff that care for the isolated dogs need to really be adherent to biosecurity protocols, including wearing protective outerwear, boots, and gloves when working with these dogs. The isolation area needs to have dedicated cleaning supplies. It doesn't work if you get all dressed up and go in the isolation room and then you forgot the trifectant. So it only take me a minute to get through that door with all this clothing on and grab that trifectant bottle I left 6 feet down the hallway. It happens all the time. And that minute, you could be taking that parvovirus or that distemper virus out on your PPE into the hallway, and then the next staff member is going to track it through it and get it all over their shoes. Need to use the appropriate disinfectant. Certainly parvo is the most durable virus probably known to dogs and people alike. And there's basically 3 disinfectants that will kill parvovirus, and it's not Parvosol. So it's trifectant, Wissy Wash, or bleach. It would be overkill for distemper virus because it's wimpy and doesn't persist outside of the dog's body in the environment for more than hours to a couple of days under the best conditions. So routine disinfectants like Parvosol will kill distemper virus. Certainly trifectant, Wissy Wash, and bleach will. Quarantine of exposed dogs. Why don't the exposed dogs have clinical illness? Well, there's 3 potential reasons. They're infected, but they're still in the incubation period. They're infected, but they have a subclinical expression. Or they're not infected because they have protective immunity. So exposed dogs will fall into one of those three categories, and you certainly hope it's the third category because they can move right into adoption and don't have to be held in a quarantine area waiting to declare their infection status. Since you can't look at a dog and tell which category it's in, you pretty much have to treat all exposed dogs as infectious until proven otherwise. So guilty till proven innocent in this case. Just like the isolated dogs need to be in a physically contained area with their dedicated staff and dedicated supplies, the quarantine dogs also need to be in a physically contained area with the same type of protocols for biosecurity. The quarantine period equals the incubation period. So distemper, it's a variable incubation period, but on average, it's about 2 weeks. From the time of exposure to the time of onset of signs, if that dog is going to have clinical disease. About 50% will be subclinical, depending on the age group. And for parvo, it's also 2 weeks, variable 2 days to 2 weeks, on average 1 week. So this is the group of dogs that you want to repeat vaccination on immediately during your segregation of the different populations of dogs based on illness. This is the group that you need to vaccinate, regardless if they were vaccinated 2 days at intake. Are you really sure they were? Or did the staff just write it down that they were vaccinated? So it's not going to hurt them to get another vaccination, even if it hasn't been a proper amount of intervening time. So we always recommend during the initial steps of the intervention strategy to revaccinate everyone. The quarantine dogs need to be evaluated twice a day. And what are you looking for? You're looking for onset of disease. And when a dog starts to express the clinical signs that you think they should express based on your diagnosis, then you need to get them out of there and put them in isolation with all the other sick animals, sick and shedding animals, so that the remaining exposed dogs won't be continually facing higher and higher viral burdens in the environment. And unfortunately, every time a new sick case is identified, you have to start the quarantine clock all over again. So that could be quite a lengthy quarantine if you have a distemper outbreak. Parvo generally is much shorter quarantine times. So we can let these dogs sit in quarantine for weeks to months while we're waiting out the incubation period, or we can start triaging them. Triaging them and using some tools to determine if they are safe and non-contagious to move quickly into adoption or into a home. So we triage based on two things. Risk for, we base the triaging on assessing risk for infection. Those dogs that have a low risk for infection certainly can get out of quarantine much quicker, and this relieves the strain on the housing capacity and the animal care capacity. The less dogs you have in there, the happier the staff will be, and you can open up more space for other dogs. We use two approaches. We test the exposed dogs to see if they have any pre-existing immunity to either distemper or parvo or both. And then we also test them to see if they're shedding either virus, depending on what the who is causing the outbreak. We use the Symbiotics rapid patient-side test kit for the immunity assessment. We've used thousands of these kits in, I think, the last 3 to 4 years. I am very happy with its performance. It is reliable and correlates extremely well with the gold standard testing methods used for either distemper or parvovirus. And we actually just finished conduction of a study comparing the symbiotics performance with virus neutralization assays and hemagglutination inhibition assays, which are the two assays used by reference labs to measure antibodies to either distemper or parvovirus. Very high sensitivity and specificity for symbiotics. And this is a kit that allows you to determine if there are protective levels of antibodies to either distemper or parvo in the dog at the time of exposure. Unfortunately, this kit cannot differentiate, sort of like PCR, that can't differentiate a pathogenic strain of distemper from a vaccine strain of distemper. This kit does not have the ability to differentiate antibodies due to active immunity, vaccination, prior exposure, current exposure, or antibodies due to passive immunity. So because it cannot reliably differentiate between those two methods of generating antibodies, we don't feel you can reliably use this kit for determining whether puppies less than 4 months of age have protective antibody titers to distemper or parvovirus. Because you could be measuring their waning maternal antibodies, the snapshot in time, and if you came back a week later and determined they had protective antibody titers, and then you're just really measuring mom's antibody, if you came back a week later, they could have no protective titers. And so now they've gone from this false sense of security that they're not going to get infected to, they're 100% vulnerable. So we don't like to use it in young puppies. This is what the kit looks like. The readout for whether there are protective levels of antibody titers or not are based on color change. The darker the blue relative to a positive control, that indicates that you're now exceeding the threshold for protective immunity. And then the other approach, besides assessing the immunity status of dogs in quarantine, is to test whether they are actually shedding the pathogen they've been exposed to, either preclinically or subclinically. For distemper, we like to use, once again, swabs for the PCR methodology. And for parvovirus, really the most practical thing still available for use is the antigen test, but you have to remember that it has low sensitivity. So dogs that don't really have signs compatible with parvovirus yet, despite being exposed, are likely going to test negative with this. Just simply because the test doesn't have a good enough threshold for picking up small amounts of virus. So then, if we know whether they have protective antibody titers or not, and we've done the pathogen testing, how do we use the answers from these two tests to determine their risk for being contagious to other dogs? Certainly, the low-risk group are the asymptomatic dogs that have protective antibody titers to either virus or both. And this would be, again, for dogs older than 3 months. They're negative on either the distemper PCR or the SNAP parvo test, and they are a low risk for being a source of infection to other dogs, so they can move on to adoption. The high-risk dogs, again, these are exposed animals, so they don't have any clinical signs, but you may have some subsets in there that don't have any protective antibody titers. So they're vulnerable to potential expression of infection. This particularly includes all those puppies less than 4 months of age. If they are negative for shedding of the pathogen, they can just stay in quarantine. and keep monitoring them. Even better, since they don't have any immunity, get them the heck out of the shelter into a foster home and let them serve out the remaining quarantine time in a very safe environment where they can be continually vaccinated at appropriate intervals. But then what about those exposed dogs that don't have any antibody titers? They don't really have clinical signs, but all of a sudden they're positive for distemper on the PCR test. I would err on the conservative side that means they're infected, they're shedding virus, they're just either in their preclinical or the state or they're going to be a subclinical dog, so I would move them to isolation and not keep them in quarantine to potentially serve as a source of virus to other dogs. And then lastly, what about those shelters that still will need to take in new dogs every day? It'd be nice if we all had the decision-making power just to halt all admissions and all adoptions, so dogs in one end, dogs out the other, and quarantine the entire shelter population for the appropriate length of time. But most shelters don't have that capacity, so they need to make some decisions about how they're going to reduce the intake of new animals that could potentially be exposed and infected and continue the outbreak. One thing that municipal shelters can do is they can call a moratorium on admission of owner-surrendered dogs, even if it's just temporary, and schedule them appointment to bring their dog in for vaccination every 2 weeks until the outbreak is resolved, and then they can come right into the shelter, and they've probably got protective immunity by that time. Certainly, based on the results I showed you earlier about the percentage of dogs that don't have protective antibody titers to either parvo or distemper, you really need to vaccinate all dogs immediately on intake, like out in the car or out in the truck. Better yet, wherever they came from. Another option that some shelters have actually used during distemper outbreaks is diversion of new intakes to another facility temporarily. Another shelter agreed to take in their dogs for a certain period of time, hoping the shelter would return the favor. Some have even called in some of the disaster response trailers, the semis that can hold numerous dogs in an air-conditioned environment to temporarily house new intakes while the outbreak inside the shelter is being resolved. And then if you have foster dogs out in the community, you don't have to bring them into the shelter to adopt them. Try to adopt them directly from the foster home or through some other off-site venue. So there are creative ways to reduce the number of dogs that you have to take, so that basically what you're left with, if you're a municipal shelter, are the stray dogs that have to be taken off the street in any of your legal custody cases. The new dogs need to be housed in a clean area that's physically separated from the dirty housing areas. Dirty means the quarantine population and the isolated population. And there should be signage, caution, or yellow tape or red tape or some sort of very well recognized signage that clearly demarcates the clean and dirty housing areas. And then it would be great if you could color code the clean and dirty areas and then color code your staff. So if you want to call the dirty area red, then you have staff that are assigned to clean and care for the dogs in the red area that day, and they got big red badges on them or on their forehead. So their colleagues can see if they're straying into areas that aren't red coded. Same for green. Green is clean. So the staff assigned to the clean area that day will have green color coding on them. It's a good way of keeping track of your staff because remember, they are the biggest spreaders of either virus in a shelter environment. It not only goes for staff, but color code the cleaning supplies so that they're dedicated to each zone. But if your staffing is too small to give divided assignments for each day, then be sure they start with the clean green zone and clean back through that first, then move to quarantine, and then save the red hot zone, the isolated area, for last. And then they can't go back from red to green, but they will try to. Thank you.